trial mode, this vaccine will be administered in people.
Right. So, insofar as the Covishield is concerned, there aren't too many issues or questions. But when it comes to the Covaxin, like you heard Ayushman pointing out, there are big questions. But in terms of Covishield, it seems to have cleared all the necessary levels. Times Network spoke exclusively to Serum Institute's Adar Poonawalla after Covishield was approved. And speaking to ET Now's managing editor Nikunj Dalmia, Adar Poonawalla talks about the vaccine pricing, its efficacy, and also the time that it will take to reach the entire population.
Well, finally, the good news we've been waiting for is here. The vaccine approval has come in, and on my screen is the man who took a risk and kept the faith and belief that by using his experience, his enterprise, he will be able to save lives. And that's what has happened. Serum Institute has got the government approval. Mr. Poonawalla, congratulations. Trust me, I can share with you the sentiment in the country after that approval, and the fact that you have got vaccines ready is extraordinarily high. So your faith and your belief and your technology and your firm has delivered extraordinarily in record time.
Yes, thank you. You know, it's been a big relief when we got the approval finally, and now we can roll out the vaccine in a few weeks. It's definitely going to bring in the new year of 2021, you know, with high spirits, and everyone can rejoice. But of course, we'll have to expect the vaccine to come slowly to everybody, and it's going to take a few months, if not a year, till everybody in India gets it. But I think the most vulnerable people and categories, as you've heard from the government, also will get it very soon. So this indeed is great news.
Okay, let me ask you basic questions which for a change are not business dominated. So the number of vaccine doses which you're sharing with us, I'm assuming that one vaccine stands for 2 dosage.
No, it's 2 shots, right? So one vaccine is given, let's say today, and then you wait 2.5 months or so, and then you give the second shot. So when I said 1,000 rupees, it's 1,000 rupees per shot, per dose. So a person would have to pay 2,000 rupees in the private market, and the government would need to pay, 400 rupees for the 2 doses for the government programs.
Okay, and the total number of vaccines also which you said is ready with you, I would imagine that has to be divided by 2 to understand the entire dosage.
Yeah, naturally, but don't forget, because there's such a gap, if we vaccinate we can vaccinate even 50 million people, in January, for example, and then wait 2 or 3 months and then give them the next shot. So in February, you'll vaccinate another 50 million and so on, going up to July, which is when the government wants to target, at least 300 million people to be vaccinated.
So I just have two quick questions, which perhaps is of a broader audience right now here, is that in terms of the broader logistics and supply management, what are the challenges do you see?
Well, these dry runs were designed to really look at what challenges would come up. The government's done a great job there. We've got cold chain trucks and machinery ready. We've got the warehousing ready, healthcare workers to inject the vaccines to the patients ready. Look, in any major campaign, there could be hitches. You've seen what's happened in the US. Things may be a bit slower than expected, but we're all in it together. We're trying our best. We don't know what hitches could come up. We've tried to look at all the possible areas where things could go wrong in the cold chain, in the storage, in the administration, and we've tried to address those. So let's wait and see how it goes, and it's going to be a learning experience. Every month we'll learn how to do things better, faster, more efficiently. So let the program start, and then we can comment on that.
And once the vaccine rollout will start and you will also start getting more data, would you be able to perhaps move higher in terms of making a better vaccine, or this formula is going to stay for long?
No, so as I said, if we do the dosage regime with a 2.5 month gap, you're reaching 90% efficacy, which is a great figure. And that's been proven in the trials abroad as well. So I don't think you need to improve that further. We've got other vaccines coming around in about 4 to 5 months, which may be the same or better and have certain other advantages or disadvantages. So we'll wait and see. But I think right now we're very satisfied and happy with the efficacy result that we have from the phase 3 trials. And, you know, as other Indian vaccines made in India also have to complete the efficacy trials before which we can conclude how effective those vaccines are. So we welcome as many new vaccines to come about and be launched in India, both by Serum Institute and other manufacturers, because we need a lot of vaccines for a lot of people.
How does one go about choosing what is the right vaccine or the wrong vaccine? I'm asking you again a very basic question, because it looks like Indians will have choice now.
Well, they won't have a choice for a few months, because we're the only vaccine which has proven the efficacy, and you've got Pfizer and Moderna as well with efficacy results. No other vaccine in India or abroad, China, Russia, anywhere else has proven efficacy and has a score. We have a score, as I said, ranging from 60 to 90%. Pfizer and Moderna is 90, 95%. We wait and welcome other vaccines. And once those efficacy results are made public, only then can I comment on how people can choose different vaccines. So we'll wait for that day to come.
I'll make 2 more quick questions, and then I know you've got a busy day ahead. Personally, have you taken the vaccine? Because I saw you at the last press conference, you were not wearing a mask. I'm assuming that you took the vaccine?
So this is my final comment. You will get a video and a photo tomorrow of me taking the vaccine. As soon as we are licensed officially and we get the letter from the DCGI, only then can I take it. And I will take it and put it out, for everyone to see as an endorsement. Thank you.
All right. Thank you very much. Appreciate and good luck. Thank you. Thank you very much. Well, that was Adar Poonawalla. Doesn't get bigger than this. And he really briefly outlined, shared, and expressed very basic things. The vaccine, according to him, the government should start picking it up from them in next 10 days. Vaccines are ready. Somewhere in next couple of months, they expect the vaccine should also be available in the public market. So that's Adar Poonawalla for you. The day finally has arrived. The vaccine has been approved.